The direct cost of musculoskeletal disorders, or MSDs, at work in Ireland is estimated to be at least €750 million a year. This is in addition to the very significant individual cost for those living with an MSD. Evidence suggests that over half of workers in Ireland report experiencing back pain each year, and over a quarter of non-fatal injuries in Irish workplaces are attributable to back pain. Up to 80% of the adult population will experience significant back pain at some time in their life, and just under 60% of workers in Ireland experience muscular pain in the neck, shoulders and upper limbs. Work-related upper limb disorders can affect tendons, muscles, joints, vessels or nerves, and may cause pain, discomfort, numbness and paresthesia. Many of these people will be seen in primary care. People living with an MSD are encouraged to manage their symptoms in a way that minimises their impact at work. Many will need only minimal support or assistance from their employer or colleagues to do this, and carry on meeting the demands of their role. But some employees may need to make changes to the way they do their job, if this can be accommodated, or to the type of work they do, if this can be facilitated. Early intervention is an essential part of minimising the impact of MSDs and the work absence that may result. It is also important to the individual's recovery and the overall success of self-management. Where it can be accommodated, putting supports in place at an early stage, based on expert medical advice, can allow an employee to remain at work. This can result in positive outcomes for both employers and employees. There is clear evidence that people with MSDs who work in well-designed work environments and have flexible working arrangements experience health, social, psychological and economic benefits. If a person is absent from work for long periods of time, it becomes increasingly difficult for them to return to the workplace. Moreover, being out of work for 4 weeks or more can impact on an individual's mental as well as physical health, even if the original reason for their ill health was a physical one. It is of benefit to an employee to remain in the workforce, therefore, and it has been shown that people living with an MSD fare better when they remain in their job or return to work. That is the key message of this lesson. Health professionals have a key role to play in encouraging patients who present with MSDs to remain in or return to a supported work environment, if at all possible. Employer and GP dialogue. Many of the work challenges faced by employees living with an MSD could be improved by a better level of mutual understanding of their needs between employers and GPs. Most employers have a limited understanding of MSDs, and similarly, many GPs have limited appreciation of the vocational or occupational dimension of many MSDs. Without an understanding of specific tasks undertaken by employees and the ability to adjust to those tasks, GPs may feel that a return to work could exacerbate a condition unless an individual is 100% fit. For their part, employers constrained by data protection considerations will only very rarely question a GP's sick note. A second medical opinion from a designated company doctor or occupational specialist is often not sought until a number of consecutive weeks of absence have already elapsed. The consequence of this mutual lack of understanding is that an employee living with an MSD is often left with no clear pathway back to work. GPs are advised to get as full an understanding as possible of a patient's difficulties as they apply to the workplace, in order to facilitate appropriate supports being put in place. Further information may help an employer understand which tasks the employee can still perform, or what support they may need if they return to work following an absence. If sick notes from GPs are not providing a clear indication of the nature of health problems an employee has, and its impact on their ability to work, employers are encouraged to seek clarification on the GP's assessment, subject to the employee's consent. This is an example of a medical certificate, which could be used to provide more information to the employee and the employer regarding interventions which might be undertaken to support a return to work. Issues around patient confidentiality and consent to disclosure of information should of course be taken into account in any interactions between employers, employees and GPs. Advice from occupational health professionals may be of value to employers and GPs alike, and where such a service is available, could be considered a very useful option. Short supplementary videos from health professionals with an expertise and interest in occupational health are available. In summary, people living with an MSD fare better when they remain in their job or return to work. And 2. Health professionals can play a key role in facilitating this.